In this video, we will explain the muscles in the posterior thigh, including their attachments, innervation, blood supply, and function. The muscles in the posterior compartment of the thigh are called the hamstrings. The compartment consists of three long muscles, which are biceps femoris, highlighted here in green, semimembranosus, seen in yellow, and semitendinosus, appearing in pink. The muscles in the posterior thigh are extensors of the hip joint and flexors of the knee joint. Let's begin with the largest and strongest muscle in this group, biceps femoris. I will hide the nearby muscles to see its origin and insertion points better. Biceps femoris is made up of two heads, the long head and the short head. Each has a different origin and innervation, but both have the same insertion point. The long head of biceps femoris originates from the upper area of the ischial tuberosity of the hip bone and the sacrotuberous ligament, while the short head lies deep to the long head and originates from the lateral lip of the linea aspera on the shaft of the femur. The long head emerges with the short head to insert into the lateral surface of the head of the fibula. The long head of biceps femoris is innervated by the tibial division of the sciatic nerve, whereas the short head is innervated via the common fibular division of the sciatic nerve. The biceps femoris is supplied with blood by the perforating branches of the profunda femoris, inferior gluteal, and medial circumflex femoral arteries. Let's move on to the main functions of biceps femoris. Both heads of the muscle act on the knee joint. When the muscle contracts, it causes flexion of the knee. The second action performed by biceps femoris is the extension of the hip joint, since the long head originates in the pelvis. The long head also laterally rotates the femur at the hip joint. Moving on to semimembranosus. Semimembranosus is the most medial of the three hamstrings, and along with the semitendinosus, it occupies the medial aspect of the posterior thigh. Let me hide the other muscles to better view its origin and insertion. Semimembranosus is a broad and flat muscle that originates from a superior lateral impression on the ischial tuberosity. The muscle inserts into the posterior part of the medial condyle of the tibia. It is innervated by the tibial division of the sciatic nerve and receives blood supply via the branches from the profunda femoris artery and the medial circumflex femoral artery. Semimembranosus flexes the leg at the knee joint and extends the thigh at the hip joint. It also assists semitendinosus in medially rotating the thigh at the hip joint and the leg at the knee joint. Finally, we have the semitendinosus. This muscle is a tendinous muscle that originates from an inferomedial impression on the upper area of the ischial tuberosity. Semitendinosus, gracilis, and sartorius all insert into the medial surface of the proximal shaft of the tibia in a three-pronged pattern. These common insertion tendons are referred to as the pes anserinus. Semitendinosus is innervated by the tibial division of the sciatic nerve, and it receives blood supply via the perforating branches of the profunda femoris artery, the inferior gluteal artery, and distally the medial inferior genicular artery that emerges from the popliteal artery. The contraction of the muscle causes flexion of the leg at the knee joint. It flexes the leg at the knee joint and extends the thigh at the hip joint. Acting with semimembranosus, it medially rotates the leg at the knee joint and medially rotates the thigh at the hip joint.